Joining us today is Dr. Jason Hitner, a general pediatrician with Allied Pediatrics in North Babylon, New York. He's also medical director of Suffolk County Community College and the Copiague School District as well. Thank you for joining us today, Dr. Hitner.
Thank you for having me.
Concussions. Nothing could be more timely right now. So much of a focus is being put on concussions, especially among young athletes. And I guess with as much as we're learning about the brain right now, concussions in particular, the key is still to get the word out about this among others in the medical field and everyone, right?
That's right. As we learn more about concussions and the associated symptoms, it's important for physicians to recognize the patient that might be coming through their doors who might not present with a history of just an injury during athletic competition. These are going to be the children who come in with complaints of poor sleep habits or declining academic performance, very nonspecific kinds of symptoms that it's important that we just include concussion in that differential diagnosis list that we consider for some more symptoms than maybe we previously had.
And you have children of all ages walking into your office with their parents, certainly elementary school, middle school, high school, and there is a big emphasis now, especially on the high school athlete and concussions. Talk more about the symptoms. What might lead you down the diagnostic path to concussion?
Right. The obvious pathway is going to be of a traumatic injury to the head. But many times, these more significant injuries can just be overlooked as just another injury and not something more significant. So again, I think that the more we include concussion in our diagnosis and the more we include concussion in our discussions, the student athletes will be discussing it, the physicians in the community, the parents, the athletic directors. The more that we have the knowledge out in the community, the more the community will filter out our more significant head injuries. Because really it's the if you see something, say something kind of a campaign where medical professionals might not be there to see every head injury, but having those tentacles in the field to help bring those patients to medical attention, I think is going to be important.
So let's say you have a young man or a young lady walking into your office and presenting some symptoms that might lead you down this path, as we mentioned. Talk about the testing now. I think this is fascinating that when it comes to concussion, it's really what is called a diagnosis of exclusion, right?
That's exactly right. We speak of it as a diagnosis exclusion, meaning that all other head injuries must be excluded first. This means that if you have a specific lesion that's defined, a subdural hematoma or something like that, where you can actually, or an epidural, I should say, hematoma from a traumatic injury, you're actually looking at a specific pathology. In the case of concussion, you're actually excluding other diagnoses, and it's actually one that lends itself more to a symptom-based and a clinical presentation-based, where you're looking for an improvement of symptoms in the absence of specific anatomic pathology.
Can it be very difficult to diagnose a concussion? Just in an overall sense, is this still something that is slipping through the cracks?
I don't think it's difficult to diagnose a concussion. I think it's easy to miss a diagnosis of concussion. And I think that's really where our emphasis is going to be placed, is on the return to the athletic competition. In medicine, we find across the fields that the most significant injury is not actually the first injury that an athlete sustains. It's actually a re-injury of a non-previously healed injury that seems to come out with the most medical sequelae. So really protecting the children, the student athlete or any athlete during that healing phase is where our priority lies. You know, they're already working at what we call a metabolic deficit. Their brain is working and using all of its resources to repair this little focal area that sustained the impact, and it doesn't leave you reserves to repair a subsequent injury. So really that's where the focus is going to lie, is be protecting the injured athlete, the concussed athlete.
And we've certainly seen that on the professional level, specifically in football, with other sports as well, the re-injury, the returning to the field of play too soon. Do you think that we're in a day and age now that we're sensitized enough so that we are going to err on the side of caution?
I think that we are going to start erring on the side of caution. You'll go into virtually any athletic facility and they'll see a sign that says, "When in doubt, sit them out." So I think that the predisposition is going to naturally fall to protecting the athlete. You want to also protect ourselves from not going too far, but I think that we're not at that place yet. I think that we're still at the place where we're expanding our catchment net to make sure that we're not sending concussed athletes back onto the field of play too soon.
So to sum up here, again, information is the key, getting the word out, learning as much as we can as more is learned about this field.
Absolutely. We're going to expect an absolute uptick in the amount of diagnoses as more and more is learned about the actual pathology and the diagnosis of concussion. And I think that this is a field that physicians are going to really need to keep their fingers on the pulse as more information is divulged.
General Pediatrician Dr. Jason Hitner on the subject of concussions couldn't be more timely right now. I want to thank you so much for joining us today.
David, thank you for having me.